So you're well known for this book that you wrote called The Pleasure Trap, which is how chemical additives, especially salt, sugar, and oil, become addictive the way our neurology was evolved in a scarcity um, setting, hundreds of thousands of years ago, millions of years ago. So what was the impetus for writing this book?
Well, I think that Dr. Lisle and I realized that it was going to be necessary to present a defensible and comprehensive overview of the philosophy that was guiding the practice that we were running, and so we decided, to make that effort, and it was a very specific goal, which was to tell the story of health from healthful living, and also explain how fasting can be used to help healthful living become actualized more effectively.
Okay. So are you working on any other books?
I have two other, I co-authored the Pleasure Trap with Dr. Lisle, and we have a cookbook called the Health Promoting Cookbook. Our chef recently came out with a book called Bravo, and I'm working on a book called Fasting Can Save Your Life, actually, with Jim Lennon right now. So we're hoping that in the next year or so we'll finish that book, and it'll really be focused on fasting.
So Doug, you said, was your high school friend.
Yes, I've known Doug actually since 4th grade.
So was it sort of you always I imagine that you didn't plan to work together when...
Well, we didn't actually get concrete plans to work together until 7th grade.
Okay.
Yeah, by 7th grade we pretty much had the plan.
But he said he has a psychology PhD?
Yeah, he's a PhD in clinical psychology.
So you planned to work together in some capacity. It ended up being at this clinic, but did he sort of have a roundabout career to get to where he did, where he's working with you? Because it seems like...
Well, he had a roundabout in the sense that he took 7 years to get his PhD from the University of Virginia, and he worked as an associate professor at Stanford University doing some teaching. But he actually joined us relatively early in his professional career and has been with us ever since.
Okay, interesting. So I have a couple more questions. In regards to refeeding, this is a regimented process, as in, like, we want to get the patient back on a healthy eating plan.
Yes.
And so I've seen different philosophies on this. Like, some people say you have to have watermelon, like that's the food to break the fast on. And I had a question from a friend of mine who is a medical doctor, and she wanted to know if there are different refeeding plans for different conditions,
yes,
specifically like psoriasis or something like that.
It's not so much different conditions as different patients. Some patients that have feeding sensitivities, you have to eliminate the foods that they might be reactive to. So typically, though, patients coming off fast will have a day of juices, fresh juices, fruit or vegetable-based juices, for every 7 to 10 days of fasting. So if they have a 30-day fast, they may have 2 or 3 days of juices. And then we'll usually introduce raw fruits and vegetables, although in some patients that have ulcerative colitis or some GI sensitivity, you may go right to steam-type vegetables rather than raw, which can be a little exciting. And then we'll just gradually bring the caloric density in the food up. So by the end, it takes about half the length of the fast to get a person back to unrestricted, health-promoting eating. So if they have a 20-day fast, you figure about 10 days of supervised refeeding in a controlled setting before they're able to return to more normal dietary regimes and healthy eating regimes.
Okay, so for the specific condition of psoriasis, that's not really a factor. It's more the patient themselves?
It's the patient themselves. Psoriasis doesn't normally present any particular untoward challenges in terms of refeeding. So typical psoriatic patient or psoriatic arthritis patients, if they've got psoriatic arthritis, if they fast, say, for 20 days, they'd have a couple days of juice, a couple days of raw fruits and vegetables, and then we'd introduce steamed vegetables, and then whatever diet we ultimately want to get them on, which would usually include starch-based vegetables, but avoiding glutinous grains and obviously meat, fish, eggs, dairy products, sugar, processed foods.
Okay. So you mentioned during your presentation about tumors. Is this something we can talk about on camera? I've heard that, like, if you mentioned that people went to fast and they had tumors and they left and they didn't have tumors, you'd be implying that they cured cancer.
Well, remember, tumors aren't necessarily cancer. Uterine fibromatomas are a benign mass that do respond to dietary change as well as to fasting. But to get a mass to break down, whether it's a ovarian cyst or whether it's a breast cyst or a fibrocystic breast disease syndrome, often involves longer rather than shorter-term fasting. If you want to have a chance of seeing a significant reduction in a uterine fibromatoма, that person's often going to have to fast for several weeks rather than several days.
Okay.
Cancer is really a whole different topic. So you have lots of masses that are nothing to do with cancer.
Okay.
And so in terms of patients with cancer, we don't see fasting as some magic cure for cancer. But that doesn't mean a person with cancer wouldn't benefit potentially from fasting, because it's a part of their overall health promotion and health maintenance strategy.
Okay.
We're
So
just not seeing it as like, that's not, you're going to fast 12 days and make your cancer go away necessarily. That's not,
Okay.
that's not the model.
It's a little more complicated than
It's
that.
a lot more complicated than that.
Okay. So I guess that is all my questions for you. Just want to, for all my viewers, to know how to get a hold of you.
Sure. If they want to go to our website, we have an exhaustive website that has all of our articles, our published papers, lay articles. We have something called True North TV, which is video clips. They can get a lot of information off our website going to www.truenorthhealth.com. If they want to call, they can call us at 707-586-5555.
All right, fantastic. Yeah, I just want to say I was really pleased with how responsive you are. I sent you a few emails and honestly did not expect to get a response at all. And I was really blown away by that. And it's really been a pleasure to meet you.
That's
I've been
great.
following you for a long time. So
Very
thank
good.
you so
Well,
much
we'll
for
look
taking the
forward to
time.
having you rotate up at the clinic when the time's right.
Fantastic.
That'll be
Thank
good.
you.